Hey, Dr. Jeff with Abrams Chiropractic. I've been getting a lot of patients asking me, what is the difference between spinal decompression and an inversion traction table? And the difference is extremely distinctive. So with spinal decompression, which we offer here at the clinic, it's specifically for patients that have bulging or herniated discs. So the symptoms typically include patients that have pain going down their legs or pain going down their arms because they have pressure on their disc that's bulging that disc that looks just like this onto that nerve root. So you got compressive load squeezing down, almost like a jelly donut, squeezing that inner jelly onto that nerve root. And the way the decompression table works is it has a negative vacuum-like sensation, a negative osmotic pressure. So it opens that area up and then it contracts. So what it's doing is it's allowing that disc to go back to the center, taking pressure off of that nerve root, all along the way of nutrifying that disc and hydrating that disc through a process called imbibition, because it's opening and closing, opening and closing. Now with traction, subsequently, what you have is you have an opening, but the challenge is if you have a herniated disc or a bulge, oftentimes that can irritate that area and actually aggravate it and make it worse because it's too much intrathecal pressure, meaning too much pressure on the disc. So that truly is the difference. Why would you use one versus the other? Use the one if you have a herniated or a chronic degenerative disc in that area. The other one is more of if you have what's called as a facet syndrome, meaning these guys right here, your vertebrae, they come down. There's not a lot of space in there. If you're not symptomatic, meaning you don't have a lot of pain, especially from a seated position to a standing position, but you just feel tight, you would use an inversion table because it helps to open up and stretch those muscles and ligaments in that area. However, if you are symptomatic, meaning you have a lot of pain from laying down or a seated position to a standing position, I do not recommend an inversion table. So if you are looking for a natural alternative to avoiding surgery for a herniated disc or a bulging disc, and you want to reduce the symptoms that you have holistically, please give us a call and click the link below.